compared to white Americans, Black Americans die prematurely from all types of diseases. George Floyd, Trayvon Martin, Ahmaud Arbery. These have all become household names, but for all of the wrong reasons. Hearing about a Black man being shot by law enforcement in the United States has unfortunately become the norm. What cell phone cameras and surveillance footage fail to capture are the injustices spread out across all the various sectors of our society. As an emergency medicine physician, I practice in facts, and the fact is that compared to white Americans, Black Americans die prematurely from all types of diseases, including diabetes, hypertension, strokes, and of course COVID-19. A recent study by Cigna found higher rates of childhood obesity, cancer, diabetes, and heart disease amongst Blacks, linked to the lack of economic resources, limited access to care, delay in treatment, and lower health literacy rates. Even when all the variables like location, age, and economic status are accounted for, Black Americans die at a quicker and faster rate in our healthcare systems compared to white Americans. Black newborns die 250% more often than white Americans in our country. Black Americans between the ages of 18 and 49 are twice as likely to die from heart disease than whites. You have chest pain, you show up to the emergency department. Well, if you're Black, you're going to be waiting longer for that life-saving initial EKG. Black men are 50% more likely to get prostate cancer and 200% more likely to die from that prostate cancer. These trends hold true for diabetes, hypertension, strokes, and so many other diseases across the spectrum. Many physicians have preconceived notions leading them to believe minority patients won't comply with medical recommendations such as incorporating exercise, and the biases extend to other minority groups like Asians and Hispanic Americans. Senator Cory Booker recently highlighted that Black mothers are 3 times as likely to die from complications related to pregnancy compared to white mothers. Recently, Dr. Anthony Fauci was quoted as saying, "The COVID-19 pandemic has shined a bright light on how unacceptable the healthcare disparities are in our country." Conditions such as diabetes, hypertension, and asthma that tend to plague minority groups at a higher rate than other groups likely contribute to the higher COVID-19 death rate. Nationally, African American deaths from COVID-19 are nearly 2 times greater than what would be expected based on their share of the population. From physicians to police officers and politicians, we need to stop and reassess who we are as a country and who we want to be.